It comes from a Greek word which means to bubble out. So it is where you see the skin has started to getting inflamed, and there are spots from where oozing or liquid has started to come out. So there's an inflammation in the skin, which is also commonly called as dermatitis. So all eczema are kind of dermatitis in literal meaning, meaning skin inflammation. And patient usually presents with itching of the skin, redness, and liquid discharge from different parts of the body. So that is what is called as eczema, commonly affecting both men and women of all age groups. So, and it's one of the most common inflammatory skin conditions which we see in India. There are many different types of eczemas. Broadly, if you want to know, it is like either external eczema or internal eczema, also called as exogenous and endogenous. I won't go into all the different types, but in exogenous eczema, the most important common types are the allergic contact dermatitis, the irritant contact dermatitis, you have atopic dermatitis and seborrheic dermatitis. And in endogenous, most commonly you will see that there is a photosensitizing factor where you can get photocontact dermatitis and even some forms of atopic dermatitis, gravitational eczema, and your stasis eczema. So these are very variety of eczemas, in all of which the most common underlying factor will be skin inflammation and itching, redness, and oozing of liquid from the lesion. Symptoms of eczema, you can divide it into either acute eczema or chronic eczema. So acute eczema is something which the patient is having for, let's say, less than 3 weeks. So somebody is having a skin issue for less than 20 days. So that is when you say acute eczema. So in acute eczema, the patient is going to complain of itching, redness, discharge of liquid from the lesions, and there can be super added infection. The patient might present with pain as well as fever. So these are the symptoms which you commonly see in acute eczema. Whereas in chronic eczema, something which is there for years and years, or more than 6 months, there we see that the skin has become very thick. There is hyperkeratosis, pigmentation changes are present over the skin, and you can see that the skin markings are often accentuated. But the skin doesn't look that inflamed, rather it looks more scaly and pigmented. So that is chronic eczema. Whereas subacute eczema is something in between acute and chronic, which has features of both acute as well as chronic eczema. So these are broadly the different symptoms and signs which you see in eczema. It is not communicable, so it's a common misconception that eczema is an infectious condition. It is not going to spread from one person to another person. It is a type of inflammation. So unless and until the eczema is infected or super infected by certain microorganisms, there is no way it can spread from one person to another person. Diagnosis of eczema is plainly clinical. It is mainly clinical. So once you see the patient, you ask the proper history and you examine the patient for the symptoms and signs, which I told you in acute eczema. You look at the skin, you ask for the symptoms, whether the patient is having any kind of significant itching, there is redness, any sore skin, inflammation, oozing of liquid, or if it is a chronic kind of eczema, long duration, where you are seeing that there is scaly patches, especially over the elbow, knee, or the ankle region, which has been there for a long period of time. There is scaling and lichenification. So these are clinical pointers which will help dermatologists to diagnose this as eczema. And if you want to confirm it, we can go for what is called as patch testing or allergen testing, which will help us to, narrow down the common trigger which is causing the eczema. And blood tests can also be done, which include maybe estimating the serum IgE levels or the eosinophils. So that helps us get a whole picture about the disease. Treatment of eczema is actually a pretty vast topic to delve into. But if you want to narrow it down, so you can think about oral measures as well as topical measures. So oral measures would, first thing which we need to give is a proper antihistamine, which will help us to decrease the itching. Itching is the primary main complaint of the patient. There is so much itching that the patient might even start bleeding due to scratching. So the first thing which we need to do is to give proper dose of oral antihistamines, which will help in decreasing the itching sensation of the patient. That will help us in restoring the quality of life. So that is the number one thing which we have to do. Second, we have to give a proper emollient, which can be in the form of an ointment or a cream or a gel, which will help us to restore the damaged skin barrier which has happened due to the eczema. So once we have, if the lesion is wet, we try to make it dry. If it is a dry type of eczema, we have to give a more greasy base like a cream or a gel to help it become a little bit more wet. So you have to reverse the initial condition with which the patient is presenting. And third and most important treatment of eczema is, of course, topical steroids and oral steroids. So if it is very severe, we have to go for short course oral steroids. But if it is manageable, we can go for mid potent to less potent topical steroids in a decreasing manner. First, we start with twice a day application, which we may taper down to once a day and later twice a week as maintenance dose. So steroids, antihistamines, and emollients. These three are the main things which we use to treat your eczema. When it comes to home remedies, there are few pointers which we always tell the patients, especially people who are having hand eczema or feet eczema due to chronic allergen or irritant exposure. We always ask them to wear gloves while doing their work. It might sound very minor, but it actually helps a lot in helping the patient to recover fast. So we ask them to always wear gloves whenever they're doing any kind of household work or handling the utensils, because the soap and detergents act as an irritant. Or when they're doing any work in a factory or handling any chemicals, to always use protective wear over the hands and feet to prevent the skin from getting exposed to the trigger which is causing the eczema. So that is very important advice which they have to follow at home. Other thing is, when the patient with eczema is presenting over widespread lesions over the body, we ask them to take very short showers, 5 to 10 minutes, lukewarm water, and immediately use a moisturizer to lock in the moisture after 10 minutes of taking a bath. So if they follow this small step, that will help the skin from protect it from becoming too dry, and even protect and serve as an external barrier which will prevent any infections. And if at all they have to look in for any warning signs, if they are getting any fever, or if they observe that some pus is coming out from the lesions, they should immediately refer back to the doctor so that they can take the appropriate measures to treat them. Other than that, they have to avoid certain food triggers. Common food triggers which might cause atopic eczema include different types of nuts, peanuts, brinjal, especially prawns and seafood, eggs. These are known to exaggerate eczema or atopic dermatitis presentations. So if the patient can avoid these food items for a limited period of time, it can go a long way in helping them recover.